will turn off our videos, but we're still here with you. So.
And I'm not introducing anyone, correct?
No, all of the bios are in the link that we're going to send everybody. And we'll send that in the chat to everybody when they get in.
Excellent. All right. Good afternoon, everyone, and welcome to a really amazing panel on the impact of COVID-19 dashboards and the use of dashboards in Baltimore communities. We're excited to have you here, hosted by Baltimore Data Week 2020, University of Baltimore, Baltimore Neighborhood Indicators Alliance, and others. This is really exciting conversation and a very relevant and timely conversation. My name is Mashariki, and I'll be serving as your moderator today. So what I would like to do, while we have a very robust and really amazing panel, we would like to start off with some conversation and some discussion around the amazing ways that the city of Baltimore has been using COVID-19 dashboards to really have a powerful impact on the community and keep the community safe. And I'd like to introduce you to Dr. Leticia Deraza, the Baltimore City Health Commissioner.
Awesome, thanks Amin, and thanks so much for the invitation to speak and the opportunity to just talk for a few minutes about the data-driven approach being taken by the City of Baltimore during our response to the COVID-19 pandemic. As most of you on this call probably know, we set up a public-facing dashboard on our website, coronavirus.baltimorecity.gov, and my colleague Natalie, who's on the panel, will probably run through this, so I won't go into a ton of detail other than to mention that if you do go to our dashboard, it does provide daily case counts. It reports on death data, the reopening indicators and reopening phases that the city is considering, as well as hospital bed utilization, our positivity rate throughout the city with a breakdown overall and by zip code. And it also includes, that website also includes a list of where individuals can get tested in the city. Most of the data on our dashboard is derived from the state's data. So the state receives the automatic feed from labs and subsequently pushes that to local health departments. They also receive death data and hospitalization information that's then pushed to us locally. The city provides the data on the dashboard around our isolation and quarantine sites and the meals that we're providing throughout the city. So I do want to just take a minute and shout out our amazingly talented epidemiologists and data folks that really help with the data analysis and the examination of the data at a granular and aggregate level. So their identification and analysis of that data is what helps us look for clusters of cases in particular geographical locations. They provide me and our teams with proprietary customized maps of those clusters. And this guides a lot of our decision making on locations that might be in need of public health interventions. They also help with performing what's called syndromic surveillance to identify trends of increased reporting of symptomatology associated with COVID-19 as reported by our local EDs prior to actually seeing an increase in case count. So I can't stress enough just the importance of using data to guide our decisions around our reopening recommendations and around testing availability. So if I could take a minute, I just want to provide two examples of how we're using our case data. So one is in determining locations for testing sites. So the city currently supports 2 stationary testing sites at Clifton Park and Pimlico, which is a high throughput testing site, and 3 mobile-based testing sites, one in the Highlandtown area, one in Brooklyn, and one in Cherry Hill. So these locations, they were essentially identified based on the data. We were seeing that in 21224, where Highlandtown is located, there was the highest positivity rate in the city. So we worked to establish one of our first mobile testing sites in that neighborhood. We've subsequently been able to work with some of our other healthcare partners to expand testing in that area. So we've had other healthcare partners based on the data come in and support the efforts that are occurring there around testing. So we've been able to transition to additional locations. We also use the data to really help provide education to the public. So Baltimore City, along with other jurisdictions across the state and across the country, are beginning to see rises in the number of cases among younger people with COVID-19. So we've seen an average age of COVID-19 cases drop by almost 10 years in just the past month. Additionally, we've seen the median age of COVID-19 cases is now around 35. It's been as high as 61 early on in the response. So we recognize that there is a need for targeted messaging and outreach that has to speak to younger people. So we're using the information that we know on demographics of residents that are affected by COVID-19 to develop the appropriate educational campaigns that are focused on young adults. So these are just two ways that we use the data. But again, I do want to thank the team who does a deep dive into the data and does the more aggregate and granular look at the data. And also want to shout out Natalie, who's here representing the Mayor's Office of Performance and Innovation, who've helped support the development of the dashboard on our city website. So I think I have a few minutes for questions.
Awesome. Thank you. Thank you very much, Commissioner. I have one question I want to ask is, can you share a little bit of the challenges of bringing together sort of disparate data sets to meet such a big need? You know, this is the first time we've all been faced with this, from the public to officials, private sector and all. And so what are some of the challenges, some of the unique challenges that you've seen in bringing this data together?
So, I mean, I would say that certainly the challenge is that there are sometimes a lot of different data sources, and there can be different formats of the data. And so being able to, again, bring it together in a way that makes sense can be challenging. But I think our team does a really good job of that. Again, there are epidemiologists and data folks who are much more skilled at doing that than I am. But I do know that there's a challenge with the disparate data sources. I think another example I'll use is even with our contact tracing. So, you know, originally we were on a system and we've had to transition now to the state system. And so there's obviously the advantage of being on one system and the same system that other jurisdictions are on, so that we can have insight into what other jurisdictions were doing. But prior to maybe about a month and a half ago, that wasn't the case. And so we were utilizing a different system and subsequently had to convert over to this system. So again, making sure that we're not, that we're not challenged by the integrity of now moving to an entirely new system that's collecting information around contact tracing.
Excellent. Thank you for that. So there's been some questions around, people without insurance may not be getting tested because they may think this is too expensive. To sort of bring that into the data conversation, how do you use data to really not only respond to that, but also target communities where that question is going to be a very big question, such that you don't have to wait until panel discussion to answer that. You can be far more proactive.
Yeah, so two things. I think going back to our mobile testing sites, we were very specific in how we set those up so that they were meant to be low barrier testing sites that don't require an appointment or pre-screening by a physician. And so anyone in that neighborhood or outside of that neighborhood, honestly, can walk up and be tested for free without inquiry into insurance status. So all of our mobile testing sites support testing without insurance or doctor's notes. They are walk-up, and so they're first come, first serve. But again, we knew that access to healthcare was particularly challenging in the areas that we selected. So in Brooklyn and in Cherry Hill, we knew that the access wasn't as prevalent as it might be in other parts of the city and downtown. And so that is why we particularly focus on those areas. Similarly, our Pimlico site, which I mentioned, just transitioned to what we're calling a high throughput site. So previously, this site was doing 100, 120 tests per session. It now can do 300 plus with plans of expanding, and likewise does not require an appointment, though an appointment is encouraged. But again, this is an opportunity for individuals to be tested without necessarily having to go through a healthcare provider, which we know can be a barrier.
Awesome. Thank you. Thank you very much. And I know you have a hard stop, so I wanted to give you an opportunity to give some last minute thoughts. And specifically, this is Baltimore Data Week, and, we celebrate open data. So wanted to just see, get some last thoughts from you, but also how does this dashboard and all of this amazing work that you've been doing in the city of Baltimore, the role that it has and the impact that it has on spreading the virtues and the role of open data across the city of Baltimore?
That's a good question. I mean, I think that part of it is that we're really proud of the fact that we were able to make so much of this data public so early on. And so, again, want to thank the support that we received from the Mayor's Office of Performance Innovation. We have a team of epidemiologists and data folks that have been supporting and been doing this work on the back end for a number of years for other disease states. And so it's kind of exciting to be at a point where we can share a lot of data, and a lot of the work that we already do around tracking data in a public way. So again, I think my one encouragement would be as much as we can obviously share publicly what we are able to share, so that the public's informed about what the city's doing to respond, but also so that the public takes the appropriate public health measures that we all can take, right? So that's wearing of the face mask, when you're out in public, as well as washing our hands and keeping the social distance. I think the value of this data is to then be able to pivot and say, as a result of public health interventions, we saw a decline in the number of cases, and we can all contribute to a decline in the number of cases by the behaviors that we each institute individually.
So I wanted to ask, you mentioned the epidemiologist, and I used to be a research scientist at Johns Hopkins, and I always like to say epidemiologists were really some of the first data scientists, out. And so I wonder, how has the role of data and this new sort of world of the data revolution, big data that we're in, how has the role of the epidemiologist shifted in general, but then also, how has that changed how you provide services across Baltimore?
Yeah, I hope, if nothing else, the role of the epidemiologist is really being elevated. So I, like you, epidemiology was one of my favorite classes in medical school. It was a nice break from some of the basic science courses. But again, I could see how having access to that data was really linked to how we intervened and how we provided patient care. So I hope that, epidemiologists, the original data scientists, I hope that their role and their value as a result of this is going to be elevated, because again, the work that we're doing, the data that we're using, we couldn't do without epidemiologists supporting us on the back end.
Thank you for that. I know, one of the values of dashboards, or this concept of gamification is where, you see, they always say, what gets measured gets improved, right? And so how do you guys think about, there's this question around, how long does it take to get results from a walk-up testing center?
Sure.
Have you seen where data helps to improve metrics like response time on things like testing results?
Yeah, I mean, I think you stated it well, right? What gets measured gets improved. And so, we're internally looking at some of the lab reporting data across the system through, through CRISP sources, and CRISP is our health information exchange, our regional health information exchange. And you're right. I think, data helps to hold us accountable for accomplishing what we say we're going to accomplish.
And with that being said, accountability, that's a big word in government, and a very important word. How do you think about sort of another big word, data provenance, and making sure that you're looking at sort of the history of data, and specifically, with these last couple of minutes, I think a key thing here is we're talking, sort of responsible data use, data ethics. I'm just going to boil this up into one bowl and give you the last 2 minutes. Responsible data use, data ethics, bias. Yeah. How do you, with this concept of accountability that you so eloquently brought up, how do you think about all of those on a day-to-day basis?
Yeah, I mean, I think the one thing that I go back to, right, is I'm also a physician, right? And so, as a physician, my natural instinct is to always want to protect patient confidentiality. It is very much ingrained in how physicians, I think, are trained and how we're trained to treat individuals. When you shift towards thinking more about the public health realm, right, now you have a group or population who you're entrusted with, again, to protect their data and to protect their privacy, but at the same time, develop interventions that are of value, public health interventions that are of value to the entire population. So I think there's certainly a fine balance between, recognizing, yes, we want the data, we want to make sure that our interventions are working, but we also want to be mindful of patient confidentiality and patient privacy. And we would never want to do anything that violates that.
That's amazing. Thank you so much. And you use the word trust, and I can tell you as a Baltimore resident, to hear you talk about how you guys are using data and how you're thinking about data and the impact it's having and the sense of accountability certainly engenders trust in the work that your office and the city of Baltimore is doing. And I imagine that is doing the same for the listening public today. So thank you very much, Dr. Deraza, for your time. We really appreciate it.
Thank you guys for having me.
All right, we're going to go on to the second part of this amazing afternoon. It's going to consist of a panel discussion that's going to, each panelist, you have Natalie Schultz-Henry, Cheryl Knott, and Mary Conway Vaughan. Each are going to do a few minutes presentation on some dashboards and some work that they're doing. And then I'm going to engage each with at least one question. And then at the end, we're going to do Q&A. So please keep your questions coming in so that I can pose them to this group of amazing panelists. So Natalie from the Mayor's Office of Performance Innovation.
Hello, everyone. I'm going to share my screen. All right. So first off, I just want to say thank you for inviting me to speak about the city's COVID-19 dashboard. I'm really excited to share this with you. This has been a really great collaboration between my office, the Office of Performance and Innovation, and the Baltimore City Health Department. The dashboard has been changing drastically over the last few months as data availability has increased and data sources have expanded. And I would like to start off by introducing you to one page of the dashboard, which focuses on our reopening indicators for the city. So this page of the dashboard shows the 5 different indicators that the city has been using to help inform our reopening guidance and phases. And the indicators themselves come from 3 major data sets that we use to understand disease spread in the city and ability to capture it and respond to it. So the first indicator is cases over the last 14 days. And these are measured on a 3-day rolling average as recommended by the CDC. And we consider that having 14 days of decrease in the last 14 days would be great and would mean that the criteria for that indicator has been met for advancing to the next phase of reopening. Similarly, we look at the decrease in deaths over the last 14 days. And for both of these data sets, we like to look at these numbers by test date and by date of death, as opposed to just by report date, because that gives us a better way to understand fluctuations that come from the reality of the disease spread, as opposed to fluctuations in ability to report it. So you'll note that the review period for those indicators is on a week more of a lag than for other indicators. So the third indicator, test positivity rate, I'm sure everyone has heard about this a lot, is just that. It's how many tests have been positive as opposed to the overall tests for any given day. And we look at those on a 7-day rolling average. And for the current phase that we are in, we would like to see our test positivity rate below 10% for all 14 days in the review period. We also look at the overall test volume. So that's the 7-day average of total tests administered by test date. And we also look at combined utilization of ICU and acute care for hospitals across the city. So the cases and death counts come from one data set, which I'll get into a little bit more when I review the overview page of the dashboard. The test positivity rate and the test volume, those come from another data set on test results, which I will also get into when I cover the testing page. And the combined ICU and acute care utilization numbers come from the third data set, which I will discuss more on the hospital usage page. So, moving on to the overview page. This is the first page of the dashboard and is meant to provide the public with a good understanding of the spread of the disease as we're able to understand it through testing and through our healthcare system, and also some information on the city's emergency response. So on the left side of the page, you'll see case and death counts over time for Baltimore City. And we show these, as I discussed before, by test date for cases and by date of death for deaths. So you might notice that these charts look a little bit different from cases and deaths by report date. And specifically, the difference here is that there's this gray window at the end of both charts for the incomplete data period. So because of a lag in test results coming back, that is about a week long, we consider all of the counts within this period to be possibly incomplete. Really, the counts are much lower for the past 3 or 4 days. 6 or 7 days ago, they're much more realistic. But we don't like to report our 7-day averages for new cases until after the date has cleared that incomplete period. We do the same thing for deaths by date of death because of the process of confirming and reporting the death. And this data here is all fed into the Maryland Department of Health's system called REDCap, which the state uses to aggregate and disseminate data on COVID-19. So at the bottom, you'll see that there's more data on cases and deaths related to nursing homes in Baltimore City. This is for both patients and staff. And you'll note that while nursing homes comprise a small percentage of cases, they do comprise a high percentage of deaths. And so this is a very large focus for the City Health Department to make sure that we are issuing the right guidance and providing with assistance and monitoring nursing homes. At the bottom of the page, there are case and death counts for Maryland, and there are links to the sources for that data because it's published publicly by Maryland Health Department as well. So on the right side of the page, we show food distribution. The city has stood up this huge effort to distribute food with partners, including various city agencies and private partners. And we show how many meals, produce boxes, and grocery boxes have been distributed by day. But if you're interested in seeing more information about how to receive food and where it is being distributed geographically across the city, you can visit the link in the description. At the bottom right of the page, we also show information on sites that the city is maintaining as support for individuals who are unable to self-isolate at home. And there are 2 categories of those sites. One is for isolation. So those are for individuals who have shown symptoms, have been recommended for testing, or have tested positive. And prevention, and those are for individuals who might not be showing any symptoms or need testing yet, but are concerned about their ability to self-isolate at home. So I want to just briefly show some more information about the other pages. So I'll go through these as quickly as possible. The region page shows Baltimore City's case count in comparison with other jurisdictions in the area. And this data is compiled by the Johns Hopkins Center for Systems Science and Engineering. They're doing really great work compiling data and showing it. And this map shows case counts by zip code by 1,000 people. I think it's really important to note that whenever we're showing case, test, or death counts on a map, that we show those per capita. So early on in the disease spread, there was a lot of discussion about zip 21215 and how it had the highest case count. But we've learned that over time, 21224 has actually sustained the largest impact per capita. And you don't really see that unless you make sure to adjust for population. We also have a demographics page, which breaks down cases, deaths, both raw numbers and per capita, by age group, by race, by ethnicity, and by sex. And if you hover over the percent of total cases and percent of total deaths graphics, you'll get those raw counts. The testing page also shows test volume and test positivity over time for the city. So again, these charts have these data in complete ranges for which we don't like to show averages yet because that data is considered incomplete. I'll just note that while test volume has expanded greatly over the last few weeks, test positivity has also risen slightly from its previous low of 4.4%. So that's something that we're monitoring closely. And we also have a map of test positivity by zip code. Again, 21224 is impacted the most. It's the zip code which does not have as much testing volume, considering the need of testing that exists there. And we have a hospital usage page. This data comes from the Facility Resources Emergency Database, which is a statewide system for collecting emergency medical service data. And all of the charts you see here are aggregate numbers for 11 Baltimore City hospitals, plus the Baltimore Convention Center Field Hospital. And you'll note that while ICU and acute care utilization has remained fairly steady over time, the proportion of COVID-19 patients versus patients in the ICU or in acute care have fluctuated greatly. So the hospitals in Baltimore City have adjusted their volume of patients outside of COVID-19 depending on the need due to COVID-19. And so while utilization has not reached above 95%, it hasn't reached alarming levels in Baltimore City yet. We are still monitoring that, especially as cases are rising in the city. The last two pages of the dashboard don't show as much of dynamic data, but are mostly informational. They show the activities that are allowed during each phase of reopening. We are currently in phase 2. And the last page, info, shows some background information on the different topics and pages that we cover in the dashboard. And the last thing I want to note is we have a survey on the dashboard itself. My team and the health department are constantly working to make sure that we put out information that's useful to city residents, and this dashboard is legible and enjoyable to experience as much as you can when you're viewing data about a pandemic that is affecting everyone. So please fill out this survey so we can make this dashboard more useful for you and make the city response even better. Thank you.
Thank you so much, Natalie. That's a really comprehensive dashboard. So thank you for sharing that. One of the questions that I wanted to ask is about data integration, especially data from different sources. How do you guys think about a lot of these metrics that you're managing, a lot of these indicators that you're managing? I imagine they're coming from various sources, and there's a whole host of integration and normalization that needs to be done. What's the complexity there, and what are some of the challenges that you're facing?
That's a great question. There is a lot of complexity there. In some cases, we are able to query data directly and feed it into the dashboard. And in other cases, epidemiologists at the health department have to query the data through systems that are, very rigorously protected and verify the data and filter it before we can populate it in the dashboard. Power BI has been a pretty good tool for incorporating sources of all different formats, whether they're CSV, JSON, stuff from a web page. We just have like a plethora of different types of data sources. And so I wish I could say that there's been a great way to standardize everything, but data sources are just changing as the need is changing. And so we're trying to use tools that allow for greater flexibility.
Thank you for that. One last question before we move on, just really quick. With respect to that particular dashboard, is it a dashboard that's showing metrics and indicators based on operational work that's happening, or is it the other way around, or is it both where the dashboard is being used for operational on the ground work?
I would say it's a mixture of both. Those indicators that I reviewed on the reopening indicators page, those are indicators that do inform the city's response and the health department's guidance for city residents. But those indicators are also used by city agencies to inform their resuming of services and the guidance that they issue employees.
Awesome. Thank you very much. I really appreciate it. And so next we want to go with Mary Conway Vaughan from Centers for Civic Impact at Johns Hopkins University.
Hi there. So I am going to do a very similar thing. I'm going to share my screen and walk through some of the data resources that are available through the website. There are definitely some things that will look a little bit more familiar, and there may be some tools that you see that are new to you. So this is the landing page for the Coronavirus Resource Center hosted at Johns Hopkins University. The whole website really started with the global map that is cited by a lot of different news agencies and is used by a number of different entities to populate their own systems to analyze the situation on the ground in their various localities. I'm going to go ahead and jump into the first dashboard that I think many of us are familiar with. This is the global dashboard that was created in January of this year. It was created by a doctoral candidate student at Johns Hopkins University. His name is En-Cheng Dong, and he is from China. And he was concerned with the pandemic that his friends and family were telling him about, and his faculty advisor, Dr. Lauren Gardner, suggested that he collate this concern into a global map. And this is the birth story, really, of the Hopkins coronavirus dashboard that is powered through the Center for Systems Science and Engineering at Hopkins. There are a lot of different units within the university that project manage. That's one of the roles that I serve, but also aggregate, interrogate, ensure the validity of the data coming from all over the globe. This site, as it looks now, is, I think, what is frequently seen in various news reports and screen capped and things like that. There's some functionality that I wanted to demonstrate, that if you click on any one particular country, the system will zoom to that country and it will reset the data specific to that country. That's also true of the various items that you see here, the different trend lines and things like that for confirmed cases, daily cases, and things along those lines. What you may not know, you may have played around with it, maybe not, but just in case I wanted to demonstrate it, that you can actually go a layer deeper into the states on the dashboard, and you can go a layer deeper still into the counties on the dashboard. All of that is available through the global map, but in March, rather in April of this year, we also launched the US specific map. And this is where I'd like to focus my time, our time collectively, as well as some of the visualizations that have been developed in the critical trends and testing sections. So the first thing that I wanted to demonstrate with the US map is that we have 4 different levels here. There's confirmed by population because, as Natalie was saying, by population is a good way to look at the data so that it's not inadvertently skewed by larger populations in larger areas, having a higher cumulative count. But we do also have confirmed for cumulative data. We also have deaths, and we have the fatality ratio. So you can go through this and see kind of where the hotspots are within the US over time. What this will also allow you to do, though, is it will allow you to look specifically at some county level data. So what I thought I would do is take a look at Maryland and then jump to Baltimore City. And the system will zoom you to the area, and you can see, here's Baltimore, but then here are some surrounding areas. You can see that the metropolitan area really is at about the same as far as confirmed by population is concerned. If we click on Baltimore, that will give you some high-level data, specifically the confirmed by 100K population, the confirmed cases, and the deaths total. Now, this data is updated once per day, so I'm certain that the Baltimore City dashboard updates more frequently than that. And the global dashboard, however, updates periodically throughout the day, a lot more frequently, because it's pulling in data from a number of different countries, a number of different states, and they all have different timelines on when they deliver data reports. So we update once per day, and then within this modal, within this pop-up, there is also what we call a county dashboard. And what this will do is it will present both baseline data about the locality, and it will also present some real-time data with respect to case count, death count, and fatality. So this information that is on the left, let's call it 2/3, is static data. This is designed so county by county, you can see generally what the baseline information is about any county that you might select. So we're looking at Baltimore now, but you could look at Harris County, Texas, you could look at LA County in California, and you could kind of jump around into different counties within our region as well, in Virginia and Pennsylvania and other metropolitan areas. You'll see the real-time data over here. For the county case and death count, there's also a roll-up by state so that you can see how things fit within the state itself. And then we'll also present the 14-day daily new cases count so that you can see what the trend lines are there. We also will show you how many new cases have been recorded since the previous day, and the county case per 100,000 population, as well as a data point about the county fatality ratio. So all of this information is footnoted, and you can see when the date of its last update was and things like that, so that you understand just exactly where it's coming from. There are a couple of questions here. Oh, those are different questions. Sorry, just wanted to make sure that I was addressing anything that might come across. So I wanted to show this because it's an opportunity to review a snapshot of information, but like I said, you are not restricted to any particular locality. You can go across the country to King County, Washington, and check out the data there as well. And some places use this so that they can do a quick review of places where their loved ones might live or their friends and family, just to see what the situation is in other parts of the state or region or country. So that is the US map in a nutshell. I realize I may be going a little quickly, but that's just because there are a lot of different data visualizations that might be of interest that I wanted to ensure that we had some time to take a look at. So I will go ahead and jump to our critical trends area. So the US map was created, or launched rather, in April of this year. We do also have trend analyses that are released, that have been released from March through as recently as last month. So I'm going to focus on ones that are more state-based. You can see that there are a few in here that may pique your interest with respect to global trends. One of the ones that we released in May is called Our State's Flattening the Curve, or rather, I'm sorry, this was early June. And what this will do is it will show you a map that has some colorization that reflects an upward or a downward trend within the state's new case count data. This is also done, this one actually is done on a 3-day moving average. And the deeper the saturation of the color, the more strong the trend line. So if we wanted to take a look at Maryland, we can click on this little icon here. We can also choose it from the drop-down list. And this will show you where the trend is for Maryland at the moment. The red highlights indicate that it is an upward trend. And you can dig in, you can highlight to understand exactly what the case count was on any particular day as well. So jumping back into critical trends, one of the newest one of the newest visualizations that we have is the state timelines. And what this one does is it's similar to the last one that you saw in that it has new confirmed cases. It does also have new deaths listed here so that you can see by day how the data was reported. The actions and the policies that we reference up above here in the title source from the National Governors Association. There's a website that aggregates all of the different actions that are announced by states across the country. And this visualization is as up to date as that site is. And what this viz does is it overlays policy decisions with the new cases and death counts so that you can see where some of these actions may have had an impact on some of the cases. So if we jump to Maryland, for example, the red lines indicate a restriction or a closure, and the green lines indicate opening back up or an easing of restriction. So this is, you know, it is not necessarily a cause and effect. It's just interesting to see where some of these policy actions fit within the overall trend. So, is there a question?
Yes, Mary, thank you for this. This is really, really amazing. And this is one of the more well-known sort of dashboards that have been viewed, and Shandong has been talked about
Sure.
many times and won all sorts of accolades. So thank you for sharing this. One of the questions is around, can you share a little bit about some of the data sources? Because we know that, you know, Applied Physics Lab, Johns Hopkins Applied Physics Lab, you know, the center at JSU, CSSE, and Esri have sort of combined to do this. Can you talk a little bit about the data sources, and then also specifically around, does the rerouting of CDC data now impact the value and the capability of the dashboard?
I knew that that question was going to come up, and the boilerplate response is no, it does not, because the reality of it is that while CDC is cited as one of the sources, which was true in January and February, that there's some case data that we were pulling there. Since February, we actually have not drawn data from the CDC reporting, so the coronavirus dashboards hosted by Hopkins are not impacted by recent decisions and rerouting of that data. So really there isn't an impact there. The sourcing that we have is through a variety of different things. Actually, what we do is we will draw, all of our sources are listed on the website, but we take data from state health departments and county health departments, as well as the COVID tracking project, specifically for testing. We take all of that data and aggregate it, but then we interrogate it against other data sources to make sure that nothing seems out of alignment. And we do also have anomaly detection on our systems so that if anything does seem kind of out of whack, it sends up a red flag and we will go and check it out. It's a 24/7 operation that the Applied Physics Lab runs in terms of chasing down some of these aberrations with data reporting, and they will post information to the GitHub if there are any delays in incorporating data. We are starting to see a trend that there are some states that are not updating over the weekend as they had been, rather waiting until Monday to update. And I think that's a side effect of people settling in and understanding that the acquisition and reporting of this data is more of a marathon and less of a sprint.
Thank you, Mary.
Sure.
One last quick question.
Mm-hmm.
You know, Natalie, used the performance, city stat performance dashboard and talked about how it's operationalizes some capabilities in the city and reports some of the operationalization.
Mm-hmm.
And, you know, you're with the Center for Civic Impact. Who is the key consumer user of this particular dashboard outside of city officials and so on and so forth? But I guess what I'm asking here is, what's the theory of change here with this dashboard? What has been the impact and effect on the larger community's usage of this dashboard?
Certainly. Well, I'm also the person who monitors the inbox for the US map general public response and things like that. And what I am seeing is that the people who are using this information, this particular dashboard specific to the US map, are people who want to cross-reference an alternate data set with what is being reported in their local newspapers and by their local Department of Health. There are also some areas where they do not have an open data portal that is being provided to them by their county, and this helps fill in the gaps where they may not have access through government resources.
Awesome. Thank you so much, Mary. Really appreciate it. Very impressive. So lastly, but definitely not least, we'd like to go to Cheryl Knott. She's the GIS manager for the Baltimore Neighborhood Indicators Alliance, and she's going to share her screen and also share a dashboard. Talk to us.
Hey, great. Thanks everyone for joining us. I know it's kind of dinner time, so I don't know how many of the participants might be snacking. It's a little tempting, but thanks for hanging in with us. So I do have a couple slides and then also the demonstration of our dashboard. So let's get to it. So again, Cheryl Knott, I am the Geographic Information Systems Project Manager for the Baltimore Neighborhood Indicators Alliance. So I'm going to talk about the different visualizations that we have put together related to COVID and harnessing the community indicators that we normally put together for our Vital Signs Annual Data Report. So very quickly, in case you had missed Seema's presentation earlier today, the Baltimore Neighborhood Indicators Alliance, or BNIA, is an organization that started 20 years ago, celebrating our 20-year anniversary, started by a group of local stakeholders. So folks who are really interested in this idea of data democratization, of data that is by the people, and about the people should be made available to the people. So opening up and unlocking data sets that had never really been available before. So we are based at the University of Baltimore now within the Jacob Franz Institute, and we take a very comprehensive look at data about Baltimore's neighborhoods. So we look at data relating to demographics, housing, crime, health, and we look at our data longitudinally, meaning we can look at data and indicators annually across time. So given that we've been around for 20 years, we have 2 decades of data and information about Baltimore's neighborhoods. We are a partner of the National Neighborhood Indicators Partnership. This is a group and organization led by the Urban Institute. There are about 36 partner cities across the country. Baltimore and Benia was a very early adopter around this idea of open data and data democratization. And I will say that the NNIP partnership has been really amazing for peer learning, and I've looked to a lot of the other partners across the country to see exactly how they're managing their community indicators, and then also different data tools related to COVID. So we're mostly known for our vital signs report. So it's an annual report. It used to be just a set of PDFs or a book. It is now an entirely digital document. It's a yearly compendium of all of our different community statistics and indicators. So we just released earlier this year, this spring and this summer, Vital Signs 18, so our 18th edition of all this data and information. And we look at data, as I mentioned, very broadly. So we look at 8 different topic areas. So when our organization made the transition to working from home, we were really interested in, working hard to push out a lot of these data sets, these indicators to the web, and then also to an open data portal that we also have for vital signs. So taking a lot of our time and our energy of sharing these data sets out there, both as GIS shapefiles, also as CSV and spreadsheets that folks can take and pull down and use. So with that in mind, with a lot of these community indicators and with everything going on with coronavirus, we were thinking a lot about what was going on in the world and thinking about these basic questions of, what populations of, what people are vulnerable to coronavirus? What are these implications of the stay-at-home order that went into effect in Maryland on March 30th? And then also, what are some of the things that people need help with right now? And so with these sorts of questions in mind, we started building some just very basic data visualizations and some tools to kind of get at these questions. So the very first thing that we constructed, and again, harnessing that partnership, the National Neighborhood Indicators Partnership, we spoke to some other data analysts and researchers who were putting together these basic infographics and using epidemiological models to estimate the approximate number of lives saved with a stay-at-home order. So a week after the stay-at-home order went into effect, this was an infographic that we released, thinking about the impact. So with 1 week of stay-at-home order in Baltimore, that would be a little over 3,700 lives saved. And then 3,700 not in a hospital, 378 lives that could be saved, and nearly 3,000 lives that could be saved with 2 months of staying at home. So that was kind of our first toe dip in figuring out, what sorts of visualizations and communications do we want to put out there. And the next came on April 15th. So I had been thinking about these indicators, thinking about different data sets, and I had someone reach out to me via email asking if it would be possible to see a quick visualization of the COVID data that the Maryland Department of Health was putting out with the historic redlining map in Baltimore, because it was a question of, was there some sort of relationship between the number of cases of coronavirus and in areas that have been historically Black African American? So that was a question that I wanted to answer. And so I did pull in some of that historical data, did a quick screen cap for this person who had this question, but then it immediately transitioned to, okay, well, let's start throwing together this COVID case data with our community indicators. And so that was our first visualization, and harnessing a lot of the data layers that have been hosted on ArcGIS Online by us and by the Maryland Health Department. So I'll do a quick live demo of this in a moment. The next visualization that we ended up putting together came as a result of some news articles that we were reading in the Baltimore Sun, looking at the the crime in the city and how it kind of compares to previous years. So again, using ArcGIS Online, we put together a dashboard that initially just looked at the first quarter of crime in Baltimore City for 2020 and then compared it back to 2019 and 2018 to see just how the numbers stack up for different property and violent crimes. And then, of course, having a map in addition to the basic data visualizations. So we ended up adding in the second quarter of data pretty recently. So after June 30th, a lot of that data was available. So we've been pushing out these updates to the map again. I'll show a demo of this in a minute. And then lastly, and kind of the newest thing that we had put together was a citizen-driven service request dashboard. And this one's kind of interesting and really cool. So again, harnessing some data that the city's been publishing, specifically 911 data, so police calls for service, 311 calls, these customer service requests to the city of Baltimore, but then also calls to 211, so calls being made to United Way of Central Maryland asking for assistance. And so what we ended up doing was pulling down these different data sets and then visualizing this by zip code. So all of these different resources are put together on an ArcGIS Online data hub. So we have the ability to view the maps, we've got the different dashboards, and so all of that is available on our website, coronavirus-bajfi.hub.arcgis. So let me go over to our internet browser. So this is the main page for the Baltimore Neighborhood Indicators Alliance, bniajfi.org. Wanted to show really quickly where to find this data portal in case you didn't catch that, if you didn't have your pen or pencil ready. So if you go onto our main page, we have a link to all of our open data portals. So we've got a couple of these actually. So this is where we have the landing site. So you can actually download some of those different community indicators. And we've got a few other different projects on here, but this is the one we're talking about here. So this is then a view, and I actually do have, let me do that. Sometimes it takes a second to load, so I did actually preload these. So when you come to this portal, the first thing that comes up is the map. So that very first really powerful visualization. And so what we do is we pull in and we directly link to the state of Maryland's data layer. So this is coronavirus case counts by zip code. So the state, they update this data set and push out a new count for the state's open data portal, that's coronavirus.maryland.gov, every day at 10 a.m. So I built a tool that allows us to pull in this data, so I don't have to touch it, and immediately gets plugged in to this, this map. And I actually have it set to update every 60 minutes, just in case they end up pushing out something new at a slightly different time. So immediately in here, we've got the different layers, and we've got visualized as proportional circles. This is the coronavirus case count. And so we have this for the entire state of Maryland. And then we look at some of our key indicators of neighborhood health. These are visualized in the background here, these different color-coded, these are choropleth data layers. So the first thing that we have kind of turned on is our indicator, and this is a data set that we track normally for vital signs that we started tracking last year. So it's a measure of digital access, so connectivity. So this is data that comes from the American Community Survey, the ACS, which is a product of the US Census Bureau. So this is a percentage of households that do not have internet at home. So this doesn't include people that have a smartphone and are connecting to the internet that way. This is folks who do not have access to Wi-Fi and they're not using a laptop or a desktop PC to access data and information. So for this indicator and for all of our others, the darker the color, that indicates a higher percentage. A low percentage is represented by a light color. So on here, we've got our different layers. And you can turn on and off these different layers just by checking these boxes. And then with this little arrow here on the right, oops, got my little arrow over here, it pulls up a legend that will allow you to see it. Is there a quick question?
Yeah, I just wanted to jump in. We've got about 2 minutes before the end of the discussion, but I want to give you an opportunity to close out here because I do want to ask at least one question.
Okay, well, I just wanted to then mention, so if you come down here, you can access the citizen-driven service request dashboard. We've got the crime during COVID. So all of these tools, they are here. You can do some filtering based on zip code, and we've got an update that'll pull in COVID data. We've got our charts, visualizations, and yeah, we do have a lot of data and information in here. So that is just some quick things that you can play around with on our website. So I will stop. I didn't realize we were cutting it so close.
No, thank you so much. This was really great, Cheryl. Really very innovative dashboard here, doing some really interesting stuff around equity. I wanted to ask, have you been tracking sort of the usage and the impact of these sorts of really innovative data integrations that you've been doing? Like, who's using this and how are they using it?
So that's something that we actually need to capture. So we just started throwing these data sets together because we had them readily available. And so that is something that I am really curious about. Is it community members that are using this? Is it other researchers? So we are able to kind of track some of the metrics on like who's accessing different data sets. We can obviously look at page views, so we can see the number of eyeballs that we're generally getting on this, but we don't necessarily know who's looking at it and why. And so that is something that we would like to eventually get a handle on so that we can start incorporating other data sets and certainly data from the city that would be really relevant and useful to users of the tool.
Absolutely. Thank you. Thank you so much. Thank you to all of the panelists. Thank you to Commissioner Deraza. Thank you to SEMA and the Baltimore Neighborhood Indicators Alliance. And thank you to everyone who, like Cheryl said, took their evening and their dinner time to sit and engage and listen. And so thank you, everyone. Really appreciate it. This was a great session. Thank you. Have a good evening, everyone.